All right, all providers have standard precautions in place, and I'm going to ask my partner to manually immobilize the leg to prevent any excessive motion and cause the patient the least amount of pain as we can. I'm next going to check for a distal pulse, which is present. Feel that?
Yes.
Feel that?
Yes.
Move your toes. Okay. This patient has a hip fracture, and the way we're going to handle this hip fracture is to immobilize it using two differently sized board splints. Board splints have a rigid core, usually made out of plywood, but one side is always padded, and we're always going to place the padded side toward the patient. Before you put the boards in place, however, it's always a good idea to place your cravats. All right, so I'm going to put one behind the ankle. I'm going to have one distal to the knee, one proximal to the knee, and one at the level of the groin. And finally, I'm going to have two cravats, one at the anterior iliac crest and one at the level of the lowest anterior rib. Okay. All right. The medium-sized board is going to be placed medially, and you can pad the groin if necessary. This board is going to be placed laterally. I'm going to start tying from distal to proximal. I'm going to tie this one so that the foot is tied into the neutral position. And to do that, I'm going to tie a half hitch, go underneath the foot, and then tie a square knot on the top. But again, make sure that you don't tie it so tightly that you cause a tourniquet effect. And anytime you can tie square knots, it's always best to use that. I'm going to go back and tuck any excess out of the way so that we don't hang that on any foreign materials as we're moving our patient. All right. Let me know if this one's too tight. Too tight? You still breathing okay?
Yes.
Okay, take a deep breath for me. Okay, that's good. We're next going to go back and further stabilize the patient by tying the two legs together. We're going to put a pillow or a rolled blanket between the two. You can let go. And this will further help stabilize the patient. Pull that through for me. All right, now I'm going to go back, check the distal pulse. Feel that?
Yep.
Feel that?
Yes.
Move your toes. With the next move the patient onto the long spine board and transform.